Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us again for another segment. When a woman tests positive for HPV, it is vital to quickly determine whether or not she's likely to develop cervical cancer. Well, in this segment, we're going to be speaking with Dr. Carolyn Kay. She's joining us here from Roche Diagnostics to talk about a new study that was published in the International Journal of Cancer. Welcome to Health Professional Radio, Dr. Kay. Thank you for taking the time.
Hi, Neil. Thanks for having me.
Please give our listeners a bit of your professional background. Tell us a little bit about yourself and discuss briefly your role there at Roche Diagnostics.
Sure. So my name is Carolyn Kay. I'm an OBGYN by background. At Roche, I'm currently the Global Medical Affairs Lead for Cervical Cancer Solutions, and I'm part of the team that brings Roche Diagnostic technology to clinicians, labs, and patients. And what I bring to the team is my clinical expertise. So when I was seeing patients, I didn't fully appreciate how far we've come when it comes to cervical cancer, and also how much more we have to go. Cervical cancer screening, it just didn't seem like an area where there are many new breakthroughs, because thanks to modern medicine, cervical cancer is not as common as it once was here in the United States. But the truth is, cervical cancer is largely preventable, and yet there are still women who are being affected by this, especially folks in vulnerable communities. And so there's still a lot of work to be done. And so what we've done is the PAP test has done an incredible job in decreasing the rates of cervical cancer. That's a fact. And with the HPV vaccine, that's another layer of protection right there. But we've come to a point where things are plateauing, and women are still dying of cervical cancer. We have an understanding of why people get cervical cancer. We have the tools, and now we need to implement them. And that's what Roche is about.
Explain briefly to our listeners, or for our listeners who may not be familiar or fully aware, what HPV is and why women that are diagnosed with it are so susceptible to cervical cancer.
So HPV is a virus that's transmitted through sexual contact. It's actually pretty common. And it's something like 80% of sexually active people can have been exposed to HPV at one point in their life. So it's a lot. And usually it doesn't really have an effect. People don't have symptoms, and your body is able to clear it. So no one's the wiser, and it doesn't really cause a problem. But for some cases, there are people where it sticks around, or they have particularly aggressive genotypes or strains. And that puts them at higher risk of developing precancerous changes. So for reasons we haven't completely understood yet, HPV can remain and become precancer and cancer if it's not stopped and treated early enough. We have HPV as a great screening test now because it identifies the cause rather than waiting to see if it's actually causing cellular changes. So we can actually, take steps before any serious problems start. HPV test is taken just the same way a traditional PAP test would be.
Now, I did mention, of course, we were going to talk about this new study that was published in the International Journal of Cancer, but I did not mention the FDA approval of CINtec PLUS Cytology dual stain biomarker technology. Is this the test that we're going to be talking about in this study?
Yeah, absolutely. So the IMPACT trial, what you're talking about, was the trial that formed the basis for our dual stain biomarker cytology test. I know that's a mouthful, but commercially we call it CINtec PLUS. And it is a prospective observational trial of over 35,000 women across the United States. So large population, and they were aged 25 to 65, attending routine cervical cancer screening. And the purpose of this test was to compare the diagnostic performance of CINtec PLUS, the biomarker technology, to PAP cytology for the triage of high-risk HPV results. And so think of it like this. If you have a traffic light, it's either red or green, and very briefly yellow, but it's never both red and green, right? If you saw both red and green at the same time, you knew there was something funny going on with the electric wires, right? It's a similar idea here. This biomarker technology involves two mutually exclusive biomarkers that should not be together in a normal cell. And we look for P16 protein. That's a protein that's associated with cell cycle arrest. So think of it like a red light. and Ki67, which is for cell cycle proliferation, like a green light. And you can't have both cell cycle arrest and cell cycle progression at the same time. So this is why we call it dual stain. And so we've evolved cytology to be with molecular biomarkers, these molecular biomarkers, rather than simply just looking at the morphology of a cell under a microscope, which can actually be subjective at times. So IMPACT gave us the robust data to show that dual stain cytology is used to improve the detection of cervical precancer and cancer when women are identified to be at risk. And this is called triage. It's better at detection than just Pap cytology itself. And not only that, when the dual biomarker test is negative and doesn't detect any abnormal cells, it's even more reassuring than a negative Pap cytology that someone does not have any cervical abnormalities or early disease.
The HPV is present. You're just determining whether or not it is likely to cause cervical cancer, or whether it can just be maybe watched if it's detected at all, correct?
Yeah, that's right. So for those who test positive for high-risk HPV, this is a test that allows us to determine who needs intervention and more closer watching, and who can be safely told to come back and retested, right? Those folks, we want to give them a chance for their body to clear it instead of being overly aggressive and over-treating them.
Are the implications more significant for those who took steps that were unnecessary, or for those who unfortunately took maybe not those steps early enough? Or is it just a win-win all the way around?
Yeah, it is. I would say it's a win-win all the way around. We want to avoid missing disease and making sure that those individuals get routed to further testing and potentially treatment. And at the same time, we want to make sure that we're not sending all these people to unnecessary treatment and giving their bodies a chance to clear the virus.
Are there any closing thoughts that you'd like to add for our listeners?
Yeah, thanks, Neil. We at Roche believe that where a woman lives shouldn't determine whether she lives or dies from cervical cancer. But that's altogether true where I live here in the U.S., and that's true around the world. The good news is that the elimination of cervical cancer is possible within the lifetime of today's youngest girl, according to the World Health Organization. And so we have the know-how and we have the tools to see widespread elimination in 2030. That's exciting and that's empowering. So let's make that happen.
And what about a website where we can learn more about Roche?
Absolutely. You can go to diagnostics.roche.com to get more information about the IMPACT trial.
Well, Dr. Kay, I appreciate you joining us, taking the time this evening here on Health Professional Radio. Hopefully we'll have an opportunity to speak in the future.
Great. Thank you. You've
been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Carolyn Kay. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.